Hello. Good morning, Professor. I am Lokanathan from PTU. Am I audible, sir? Good morning, Director. Am I audible, sir? Is that my screen visible to you? Any other participant? Can you hear my screen? View my screen and listen to my speech?
Yes, sir.
I need some response to go ahead.
Yes, sir. Audible.
Ma'am, shall we wait a few more minutes? Now the audience seems to be very less. Hello. We start the presentation. Good morning, Anjali Devi ma'am. Good morning, Diana ma'am. Good morning, Lavanya ma'am.
Morning, sir.
Can we start the presentation, ma'am?
Yes, sir. We'll start, sir.
Is that screen is visible for you?
Screen is blank at present, sir.
But it says that present for me and stop sharing. I'll restart again, ma'am. Is that okay now?
Yes, sir.
Yeah. Very good morning to everybody.
Morning, sir.
Today we are going to discuss about information that plays a vital role. The information that we share on the computers are to be safe and maintained properly. On this line, we have the information security as an important topic, and I have been invited to deliver on this. Let me have a few words of introduction. I am Dr. Loknathan, professor in Puducherry Technological University. This Puducherry Technological University is also known as formerly as PEC. We are going to discuss on security information or information security and related topics like infrastructure for medical professionals. When we say security, for whom? From whom? How? And is it acceptable? That's what major aim. Security for whom? Of late in the newspapers, we find medical professionals are attacked physically by the relatives of patients. Similarly, there may be possibility that information, data that we store may also be attacked, and hence we need information and data to be secured. When we say secured, it should be permitted for accessing only by authorized users, and stored data may be disclosed are permitted for changes only by authorized personnels, and the data may be need to transmit it or sent only to authorized persons. This we call it secured processing. We want to protect from unauthorized use of medical data, unauthorized access of medical data by others or outsiders. The same way, the data information we store cannot be, should not be modified by unauthorized people. The data and information shall not be damaged, deleted, destroyed by unauthorized people. What are the accesses needed? We say medical data is the data to be made available to patients. That is, whether the patient to be informed of day-to-day collection of data. Is the data relevant to patient? Can it be informed or disclosed to relatives of patient? The employer of patient wants to know the details so that the patient may be permitted medical leave, for which the patient's employer needs some information. Does it mean the employer is permitted to access data? Of late, for various medical treatments, we go for insurance. Even the government, banks provide various kinds of insurance. In such scenario, if the patient details is made accessible to insurance agencies, coming to medical field, the duty doctor who is on rotation is to be disclosed, is to be informed of patient details, as well as the duty doctor shall be permitted to enter, modify the current scenario, current details of the patient, so that duty doctor and concerned personnel can provide appropriate treatment as well as enter the data. Similarly, the patient details need to be accessed by various scanning facilities in the hospital as well as lab testing professionals. The recordings, scanning details are to be updated by the respective professionals. The duty doctor may communicate to his or her supervisor periodically on the treatment provided, and hence the supervisors should also be permitted to access all the details. Same way for billing, recording, later auditing, the details need to be stored and accessed by hospital management. Okay, let's go ahead and see in detail authorized disclosure and modification of already existing data. Patient data can be shared to experts of other hospitals in case of emergency, in case of outside consultancy. The patient details need to be disclosed in case of necessity to police officials and investigating agency, and certain scenario may arise in which patient details need to be disclosed to the court officials for judicial needs. In the present scenario, the existing data mostly not permitted for changes. Only we go for updation, recreating if the need arises. So this is about disclosure. Of late, on the net, we find PDF editor. Normally, we say PDF documents are not changeable. However, we find PDF editors that are available, and these editors help us to change the data, to change the appearance. And the next one, we want to preserve and disseminate data. Most of the time, in the present scenario, data are maintained in manual records. For example, a new patient arrives. The patient details such as name, age, Aadhaar information are entered into compute and given in the form of a physical record, and the patient is to go around to meet outpatient doctors and lab facilities for getting the treatment. The manual record, when submitted to the duty doctors, whether it is outpatient or inpatient, they check and provide needed facilities and enter appropriate details in the computer. So we have both manual record and computerized data. Computerized data is kept in the computer, updated by various professionals. Manual record is kept with outpatient in the form of say an ID card or an observation sheet. When it is in the form of computerized format, it is possible and easy to take multiple copies wherever needed, and it is possible and easy to share with duty doctors who are on rotation. The computerized data easily accessible to scanning facilities, lab professionals for verification and for updates. In addition to duty doctors, the patient details may be need to be accessed by supporting assistants in the hospital. Moreover, the higher management of the hospital wish to have access and preserve the data. In such scenario, we talk about information security as authorized access by only authorized people and protecting these information resources from unauthorized use and access. We want to protect from unauthorized disclosure and unauthorized modification. Same way, the data shall not be damaged or destroyed. Now let's see how to stop unauthorized use on the computer or manual data. Here are the few samples. Can you read this one? Is it
The
visible
slides
to
are
all
not
of you?
Sir, slides are not changing.
Slides are not changing. But surprising. One second. I'll restart the presentation again. Let's see. Because it says stop sharing on my screen and restart again. Is this screen changed now?
You are in 10th slide now.
Yes, sir. Yes, sir. To just
Can
have
you
a
change?
recap, I just put the previous
Yeah,
slides.
changing. Yes,
It's
changing.
all only about what I have said so far. It is the first slide. Just to say about medical professionals, security for whom, from whom, how, unacceptable to us. The patient details, like who can access and how is it stored. Now we find some methods with which that unauthorized use can be stopped. Is this now visible, sir?
Yes, sir. Yes, sir.
There are so many methods. Simple one is to check signature. Manual records are verified by duty doctors, concerned professionals, by signatures. These signatures are stored in the computers too and verified wherever needed. Another one is a password or pattern lock that we use very often with our mobile phones and our log mail IDs. All of us are familiar with passwords or pattern locks. We come across password as alphanumeric ones and switch on passwords. For example, cell phone or laptop need to be switched on only with password or patterns. And we also have certain extra facilities so that the user is verified by providing auto lock facilities for every record or every record changes or for time delay or sometimes when the screen is inactive and we come across strong and weak passwords which are to be used and kept in mind. Many a times device to device interactions are performed by auto generated passwords. One time passwords are, are also provided for various uses, and these one time passwords are generated by the systems The next item is fingerprint identification. Fingerprint identification is the oldest one and widely used one. We come across fingerprint scanners in various formats. Here are few examples and commonly used one, cell phone based fingerprint readers. Same way, face can be recorded, verified and installed on various places. Cell phones have face lock, so only the authorized user, when he switches on the cell phone, is permitted to use. The same is to entry doors, laptop systems, personal computers. These verifications are easily implementable based on retina used, widely used because of its advantages. Retina biometrics, retina biometrics as an easy concept can be accessed with low intensity coherent source and can store. We have seen few concepts: signature, fingerprint, face, retina. What happens if they fail? For example, fingerprint is not recognized. It's a statement we often hear. So we retry. In case of debit cards, credit cards, when it is put on ATM, if the PIN number is erroneous, we can try for few times. If the trials are exceeded, we may have to wait for a large time delay, such as 24 hours or 48 hours before using. In case it is required to be used, we need to contact higher officials in data center for the need. That may be necessary that we may have to go for re-register ourselves, stating that our records may have been modified. To overcome the difficulty, we go for multi-mode authentication facility. In the case of multi-mode authentication, we have multiple methods of identity claim, such as ID card, fingerprint, face recognition, audio recognition, and so on. So even if one fails, we can try another method and try to access permitted data. We shall break if any questions are there. Assuming no questions, we proceed further with what is information security. The information security revolves around three terms: confidentiality, integrity, availability. Combining the first three characters of each word, we call it CIA of security. When the security was being discussed about decades ago, CIA is said to be very popular, and the CIA, called confidentiality, integrity, and availability, revolves around the three terms called threat, vulnerability, and risk. They are connected together as threat is a set of circumstances that has potential to lose or damage the data. Threat of interception, interruption, modification, and fabrication of data. So we need to control the threat by a protective measure. We use another term, vulnerability. That's a weakness in the system. So we use a threat is blocked by control of vulnerability. So when the risk is a topic is interconnected with threats, vulnerabilities, asset, asset values, all these related. So we discuss about security requirements. This security is met by establishing controls. When controls are implemented in a proper way, it reduces the risk. The threats, which are always changing, increases the risk. The vulnerabilities tries to access assets when they are exposed to them. So we need to keep the cycle active and keep reducing. In the present scenario, when the data are computerized, what is the vulnerability? What makes vulnerability? It is the anonymity. Anyone can access computer in a remote way. For example, we talk to our relatives, friends, and employers through our cell phones. We do get unwanted calls from unknown people. Same way, the information that we have stored is, is attached by multiple places. The data are easily shareable, and the system that we look is very complex and it spread over large distances. Even if I make a call through my phone from my place to next desk, the person sitting next to me, the phone call data passes through unknown path. For example, it passes through neighboring routers, maybe satellites, and comes through number of places. And hence the cost of the data sharing is, is changing all the time and unknown many a times. Then who is attacking? For example, we solve we solve puzzles in the newspapers. We play games on phones. Is it an attack? The attackers are classified into amateurs, crackers, and career criminals. Categories of which career criminals are to be looked into properly because their motive is to modify by challenging the security to gain unwanted fame. Uh, they may try to extract money. They may go for attacking our systems for differences in ideology. Similarly, the data on transmit may be affected by varying concepts such as protocol flows, impersonation, spoofing, confidentiality threats. We look at these ones by message integrity threat. That is, the data has lost its integrity. Website defacement refers to changing the web content. Denial of service is another, in which the required systems or data are not made available within the time stipulation. There may be possibility that data is modified on the way. In addition, there may be persons who overseers, called eavesdropping, tapping. Even though we say wireless transmission, the data is being transmitted through cable from place to place. In such scenario, the data may be accessed by other methods called the sniffer and inductance method. The microwave communication, satellite communication permits multiple persons to access it. Communication have interferences and can lot of difficulty arises. In the case of manual records are carried by person to person. So person can be verified and appropriate treatment can be given. In the case of computer data, we need authentication or authorization. Both are have minor variations, and hence there is the possibility of impersonation. Impersonation leads to changing data by other persons. For example, masquerade is hiding data, session hijacking. Third one is man in the middle attack. These methods lead us to integrity of messages. We will have a small break after a few slides. The message confidentiality is attacked Good morning. I'm in case of no queries, we proceed further. This we need set of boxes.
Good afternoon, sir. Is it audible? Good afternoon to one and all. Is it audible? Please, one of you respond, please. Hello. Good afternoon, sir. Good afternoon to one and all. Okay. Is it audible? Someone has messaged me. Yevarani. Okay. So I'm starting here. Today our topic is the future of healthcare technology. And the future here, for every each at every point, the future lies in the expectations and innovation. If we are triggering the innovations, we can reach our expectations. That's what this peak curve represents. And uh, and if it is as per the trends of the life cycle, we can get all these things as per the wish. And in case of our healthcare, the consumer self-care trend, uh, it is like self-reliance personalization, and means nothing but here the self-reliance is nothing but if we the one has to take care of their own health care using some or adapting some technology, and this can be personalized and through an innovation by using the technological tools like new tools, new choices in consumer health. Like this is an example I have shown here, the ultrasound scan pictures, and even we can take like nowadays even the mobile is even able to take the X-ray picture, real-time feedback and actionable information we can get through our mobile gadgets. And the health care is again enhanced based upon the information biological and nanotechnology to the atomic level, and then neurons and then genes bits all into the depth. The more advancements enhances the human performance in the healthcare management. In 2010, the healthcare was like first predictive, then prevention, and then thereby we will be promoting the health. But as we go on, the plan is changing, like health promotion, in um, the first preference is given in health promotion, then it is given for the disease prevention, and then we are predicting. So here. If you see in hospitals, modern hospitals, they'll be having lot of files, medical papers and records and all. This has been reduced by including health information technology, and then the current healthcare waste is reduced, and um, the health IT would save money. We already discussed the health IT means health information technology will save the money and significantly improve the healthcare quality. And this caused the smart health IT revolution. And the health information technology trends are like digital transformation, quality control, culture issues. Here, the digital transformation is nothing but you can see here the picture. Digitalization here includes, in case of healthcare, instead of the presence of the doctor, here you can see a computer with an apron and a stethoscope here. represents the physician. It's nothing but there is no need to go to the physician personally. And instead, like a video conference or Skype, in the olden days, all these things. So we can have the digital, we can use the digital transformation, and then thereby we can control, and then all the issues can be resolved. This by using this technology nowadays, telemedicine. There's nothing but the telemedicine over the phone. We can get the medication in case of corona all times also. We know all that in the pandemic times there is no until and then there is a medical emergency or any other, say even with the high priority cases, physician even is not also, not even a physician is willing to treat or meet the patient. So that time they have used this telemedicine system, nothing but teleconference. Using teleconference, they are going to give prescribe the medicine, the telemedicine, and see, now the research is being is that the future of the healthcare technology. It is more the macromolecules to micromolecules. Now we are going into the depth of the cells, micromolecules, and into the atomic level. The research is going to be developed, and then the research is nothing but the surgeries, robotics, tele-robotics. Even nowadays, to get a surgery, laser surgery for the eyesight correction, there is no need of any personal these things. We can do with the laser, which can be completely done by the use of robotics. And not only these things, even a small mass or calculi, which is developed in the neuron nervous systems in the brain, parts of the brain, can be melted by focusing that tumor with the beam of laser light focusing, which is now a well developed technology which is followed in imhans and all, so that the mass, food mass can be which can be uh, dissolved, and then thereby it is going to be by focusing the laser light, beam of laser light, this will get dissolved, and then thereby the tumor can be treated. And this we can see here. See, by using the laser lights, there is no need. In olden days, we used to till that open by bypass surgeries, like opening the skulls and all those things. We had the need to do to correct some blockages or any other mass or any other calcium materials present over this. But nowadays, there is no need of that much physical or very huge process, just by using robotics. Not only in these things, robotics we can also use in the knee replacement techniques, which is an advancement, and the future has in if, the current trends in the healthcare system. This is all by the clubbing all the technologies and then robotics, all these things in healthcare system will give you the better patient care. We can avoid the personal errors, and then thereby we can give more better patient care. And the next generation internet medical delivery platform, here there is no need to even go to the physician and then suggest and all those things. Now here you can see the wireless medicine models like internet, through internet or cloud 9 technology, communications, messaging, personal data, and enter voice messages, wider area voice, then thereby will be the communications is three-way, between the hospital operations and the communications from patients, and then clinical, all the clinical is a the three-way communication, and thereby by using internet, if there is even there is no telephonic conversation, through the internet, using internet we can make the communications through hospital, and get the hospital operations and clinical operations, instead of going or visiting a hospital. This is a mobile healthcare management, where in all the information is going to be transferred through the via internet, and we can use all these things by wireless gadgets like mobiles and all mobile networks, and then all the things, and even we can sit in the home and we can get the patient care through mobile. So now 3D detection by using 5G technology, and we can use more immersive communications. And in case of real-time health IT visualization, we can identify the proper place of the problem, like sinus nodes and internal pathways, into the depth or the correct exact location of the problem areas. And these are nothing but into the robotics only. And we can go into the neuron level now. That technology has been greatly improved into the micro molecular level into, and also it again is going to develop into still more getting refined into atomic level. Means we are going to get where the which the excess of which atom has been replaced the technology and all. And the future medical operations, like you can see here, the all the three centers, three systems, or three screens. See, if the patient, and even the doctor is also not here. The patient will be explaining the problems, and the care providers, patient healthcare providers, these persons, even though patient, they will be communicating between the physician or the doctors and the care providers. By using the care providers as the mediators, the treatment is going to be passed away. And the broadband diagnostics here, in case of this is an example for musculoskeletal system. Even by using the chips. Nowadays, there is a very huge research, and then huge development has been developed. Even we can, without doing any surgeries, we can even identify the problems of the muscular system, either the muscular system or the skeletal system, by simply passing the IRS, infrared rays, and we can get diagnosed easily. And this is the diagram which shows the real-time bio IT visualization information technology by using the technology. And even by taking your thumbprint, you can get all the data of your DNA level up to the DNA level, and then some of the characteristics which we used to do the finger by using the finger thumbprint nowadays, which is connected to the Aadhaar. And we can even diagnose in the COVID time pandemic areas. Based upon the Aadhaar card number, the person can be diagnosed, can be concluded whether he has taken the vaccination or not, or whether he got admitted. He has been diagnosed corona once or twice, and is with or be, this is what is the time period, and thereby they can be either given visas to travel a lot, a travel distance to the other countries or abroad. And here you can see, I'll show. Even in case of in the current trend, there is no need of wire, and it is like now the future is like wireless health portals, like electronic gadgets. See here, they will be getting all the wireless connections by using Cloud9 technology, and that telemedicine is distributed through real time. And the future trends in 21st century will shape like this. See here, the smart electronic medical record. This will be like we'll be using some electronic gadgets and all the things to store or scan or diagnose or to prevent whatever it may be. And we can use this electronic gadgets for now in case of this Google, Microsoft, they are developing a faster app, which by touching or by pressing that, even we can know our BP without the use of stigma manometer, where we in traditional conditions we used to measure our BP and all by using the stigma manometer. But here it is not, there is no need of any instruments. So this will be an advancement. And here, to what is the enhancement will reach means till curing the disabilities and the longevity of life, and then intelligence using the artificial intelligence and all, and the emotional controls, aesthetic expressions, and quality of life. So these are all the benefits of this technology, and where we'll be going to get in our future, nearby future. Um, and here it is, we can regenerate in the future. The treatments and the healthcare is going to develop in a way, such a way that we can regenerate all the parts of the body by getting the stem cells of particular, and then we can get on whatever it may be that. So here, if you are triggering with the point, why we not start now, or why are the what are the mega trends transforming the medical and health industry? If we think in this manner, steps like how to become a trendsetter, and what are the mega trends transforming the medical health industry, and why not to start now? If some so many companies are coming up with this in this strategy, and they are developing, and they are becoming the trendsetters, so that the trends are important, but if you want to be a trend setter, everyone 97% are thinking that trends are important, but only 45% will be thinking about to become a trend setter, and then companies doing enough for trends will be only 2%. Means here now, even though all the companies are in a competition towards knowing the trends. Here, and what are the megatrends transforming the medical and health industry? Like the evolution of mankind. So if mankind developed, and then further they have they were using system. Then a small gadget, nothing but a tab or mobile, and then now not even a tab or mobile, a very small thing, telepathy like instruments. They will be wearing just to the eyes. You can see this one, the same picture. Means the information technology will be improving day by day, day by day, day by day. So here, the evolution of mankind till a computer, and then after the computer, within a single touch, like mobile, using a mobile gadgets and all, and after that, a small this thing, telepathy bands and all those things. Then even there is no need of small aperture. He can simply wear the uh, a spectacle like instrument where he can see all the data. No need of screen. It's called as telepathy. Even by using this wearable intelligence HIPAA compliant platform wirelessly enables doctors, surgeons, and nurses to achieve greater efficiency, and then collaboration, patient satisfaction. See, there is no, in case in the current scenario, even we can see by wearing the chips or the jackets, which can diagnose the rate of speed the person or the athlete who is running or doing his physical exercise. The speed is mentioned like 12 kilometer per hour, and he is running in the morning time, and the distance how much he has run, and the temperature at which he is running, or the temperature of the body maintained. So these are all automatically screened to the person without using any other instruments or any other apertures, by wearing a simple jacket, athlete jacket, where the chip is attached, and which will be monitoring all the things. Previously, we have discussed that there will be a watch like this, the speedometer, and a speedometer which is fixed to the bicycle to control or to monitor the speed of cycling, and BMI, like by using these things, and these are all. But here, in case of wearing an athletic jacket itself with a chip inserted, will be monitoring also. That is very, it is very comfortable, and we are going towards highly sophistication. Um, And even we can monitor the heart rates by wearing the athlete jackets, heart rate, and the distance travel, and the water input taken, and the speed, how much you are going to, how much speed you are making the walking or exercise, and the time to till for how much time period you have continued your workouts, and This is given by the terrain company you fill and all. This we know, this is the body mass index calculator. Where previously, we used to check the weight and then we used to do the calculations and we used to find out what is the body mass index. But there is no nowadays in this automatically by the infrared rays help, which will be knowing your height and then taking your weight. It will be calculating the body mass index. It automatically. There is no need of even manual calculation or any other using calculators. See, now even days without consumption, how much we are eating and what, how many calculations in location where you are taking and how many calories you are taking, at which time you have to take. You can maintain your physique or attire by concentrating upon your intake or consumption of food. As we go on, the future becomes like they'll be more conscious about the health. They'll be becoming more health conscious, and then they will be getting. More and more conscious about the food intake, a balanced diet, which prevents so many unhealthy conditions, and then like these electronic gadgets, which will be continuously monitoring, and then they will be alerting us to take water, to take rest, to walk this much, and to maintain the posture and all those things we can be maintaining this through the alerts given by the things. And these are wearable sensors, as we discussed in the athlete jacket. These are wearable sensors which will be measuring the workout gear measures and then the muscle exertion and tracks, etc. And waistbands, as they which are like similar to the watches, wrist watches, which will be scanning the blood, scans the blood and tracks exactly what warriors eat. So this thing, based upon in case of diabetes, this will be measuring the thing what you are eating and the blood glucose levels. And then see here, it is showing what you have eat already. The wearers means the consumers who are wearing this aperture gadget, uh, like fats, proteins, and carbohydrates, whatever you are consuming, it will be tracking or monitoring all the things. There's nothing but more conscious about the health. So nowadays, everyone is becoming this. This shows that this clarifies that everyone will be more conscious about the health and right. And in case of the big data here, we can predict even the future. You can you can spot the by using the medical boards offers ad hoc care. Even we can spot the problematic area by telepathy manner. And this like using shops health check. This chair monitors health and sends vital statistics to doctors continuously. Even though you are not in a hospital, you will be monitored as you are in an ICU. All the it monitors all the vitals and all the things. And you can see this glucose sensing contact lens. Uh, I mean, if you're wearing this contact lens, it will be sensing your glucose levels in your body. See, this very friendly even for the children. Means nowadays the science is growing. Science and technology is getting more and more friendlier, and then eco-friendly, and then even very easy to monitor. See here, a simple stamp like aperture. See here, a simple stamp like aperture or adhesive tape or simply even like a band-aid, the child has been attached with a biosensor. So what is that? This will be monitoring all the vitals. The biostamp for electronic tattoos will be monitoring and tracking the vital levels of the body. The sensors enable field that can monitor patients' adherence to the medication, whether you are getting the medication properly or not, or even sometimes we can give by means of things. The medications in case of the medicine pharmacy also nowadays the enhancements upgrades the drug delivery system to give as a adhesive film technology, so that there is no need to swallow or no need to inject or anything. This transdermal technology, we can use the transdermal patches and simply the drug can be delivered without any other side effects or minimizing the side effects. And this is the biostamp for electronic tattoos of University of Illinois, which has been. And with more and more improvements includes like digestible sensors. Even though you are taking inside the body, sensor enabled pill that can monitor patient's adherence to the medication. Means once you consume this pill, when you are consuming along with the medication, what happens, it will monitor the level of the drug percentage or the drug concentration inside the body, and it will give a synthetic and will give an alert, how much you have to take, again what's the time again you have to take to maintain the therapeutic level. By using these sensors, we can understand the concentration, or we can monitor the concentration of drug inside the body, thereby to take one more dose. So these are all so you like it is like simple wireless smart headphones. By using these things, you can monitor all the health activities. So nowadays, like this, by going and going into science is getting more and more friendly and feasible for the better patient care. See here, micro device offers 10-second checkups. Within 10 seconds, we can get checkup all the blood glucose levels, blood pressure, and all. Uh, and it is very easy to carry. It's a very small aperture and device. Uh, See, to know the Bella beat is nothing but here to know the heart rate and all those things by using a small aperture we can monitor. And then there is, this is the smallest, world's first baby vitals monitor, very smallest, all it. This is the very small gadget which can be worn to the infant, like, and which will be monitoring the vitals of the body of the infant continuously by wearing this gadget. Is very friendly. This is an which also the Olet vitals monitor, which also again measures the or monitors the heart rate, oxygen, temperature, rollovers, etc. So this is about the future of our healthcare system, healthcare technology. So this will be the trend, and it will be going on. I want to expand the point. Previously, it was like we will be monitoring. We will be after symptoms attend only. We will be monitor. Will be starting the treatment. Nowadays, because of the more and more higher version of the healthcare technology, instead of before the starting setup of symptoms, even we can start the treatment because of the higher improvements in the healthcare system. So this completes the future of healthcare system, and the next topic is future health records. Nothing but the electronic health records. And here we are going to discuss about the background relevance of ICTs, and the relevance of standards of healthcare sector, cases of EHR standardization. As per the Ministry of HR, Ministry of Family Health and Family Welfare Department, and it is notified as per EHR standards. Important policy and directions. First, here, the healthcare area is highly data dependent. As we discussed yesterday, the data is the raw material. So, based upon this only, we can gain some information or knowledge, and then thereby we'll be getting the more streaming, more scrutinizing the knowledge. We'll be getting some wisdom. So here, the healthcare area is more highly dependent upon data, and the data is having a higher significance. Power of this ICTs lies. ICT is nothing but information and communication technology. The information is coming from the data only. The data, if it is refined, and then it is called as information. And the communication technologies. These are nothing but understanding understanding these ICTs. How can it is provided? So first, the main step, basic step of this ICT is data, and it lies its capacity to get more effective healthcare. We have to dependent upon more data, and we have to access the data and then store data, and we have to analyze the data, and then we have to transmit. So this information got from the data is how to be communicate, and then we have to analyze again, and then we have to transmit it into the required format. Utilizing this capability of ICTs has the potential to significantly contribute in the preventive care, improving delivery and then disease control, medical education, medical education and training, health management, and health research. So this is the use of this ICTs, and the need for standardization of this healthcare sector is a set of guidelines or standards optimally leverages existing technologies, ensure continuity to evolving technical innovations, and deliver cost-effective solutions and sharing medical knowledge. This if we are not having a proper guidelines or standards, we cannot optimize, or we cannot refine into optimization is nothing but yeah, refining or to get more worst, more VER is to goes fine to most refined solutions for a problem. So if you are following a strict guidelines or standards, we'll be getting more optimum conditions for getting ensure quantity of evolving technical innovation, deliver cost effective solution, and sharing in medical knowledge. This would help indigenous enterprises provide the right platform for e-health and provide all with a practically attainable and sustainable standard of healthcare. And to provide a framework of interoperability and scalability across health information systems and e-health, mental health services, and within the country and outside. This electronic health record is one of the most important parameter in this standardization. So this is a healthcare, the need for the need for standards for healthcare sectors to develop an healthcare electronic healthcare record is most important parameter. An example of accepted multimedia teleconferencing standards, like the International Telecommunications Union (ITU) um, and T120, H320, H323, H324 standards. These are the standards that comprise the core technologies for multimedia teleconferencing, conferencing or video conferencing. Means this will be a having the um, some these standards will be having some rules and guidelines to follow this teleconferencing, and then this TI20 standards address real-time data conferencing, and this H320 standards addresses ISD and video conferencing, and then H323 standard addresses video, audio, visual, both communication on local area networks, and whereas the H324 standard addresses high quality video and audio compression over POTs, modem connections. Here, what is a electronic health record? Is nothing but a repository of information regarding the health of a subject or a patient or a person of care in computer processable form. Instead of maintaining a paper format patient history or a record, health record, it is maintained. A repository is nothing but maintained in the computer processable form. Means it can be used either any of the commutable computers or any other system, and it is stored and transmitted securely and accessible by multiple authorized users in along with the patient or the user or the subject. It can also be accessed and is authorized to access by the physicians or the care providers or any other authorized persons. It has a commonly agreed logical information model which is independent of EHR systems. And means it has a logical information model. The matter is given in a logical manner and in a stepwise manner where it is independent of electronic health record systems. Purpose is to support of continuing efficient and quality integrated healthcare, and it contains information which is retrospective and concurrent and prospective. The integrated care EHR as defined in as per ISO standards, and this is electronic medical record. This standards committee of Ministry of Health and Family Welfare of Government of India constituted a committee of experts for development of standards on electronic medical records in September 2010, under chairmanship of Additional Secretary and DG CGHS of Ministry of Health and Family Welfare. The main objective the main objective of the committee to recommend a set of EMR standards for India to be followed by both the public and private healthcare providers, and this procedure for continuous upgradation. To set up all the main this committee has been set up to recommend a set of standards for India to be followed by both the public and private healthcare providers, and also to upgrade continuously. And the activities undertaken by this is the EMR Standardization Committee set up following subgroups in October 2010. Subgroup Task 1, this controls the standards and the terminology used in the EMRs, electronic medical records, and coding standards in the codes if they are using anything. This has to be very clear. If the coding and then terminology is not used properly, it may give further confusions. To avoid these things, we have to follow some certain standards and guidelines that is governed by the subgroup task 1. And then subgroup task 2, this governs the data connectivity, including including the person, and then health and family welfare, and interoperability. This again the subgroup task 3. This governs the data ownership, data protection, and including security and legal aspects. And the current EHS standards are a result of deliberations of the EMR Standards Committee and subgroups, and consolidation by the subcommittee under FCCI of the public comments on the draft report put up by Ministry of Health, Family and Welfare. This in their website in May 2013, and deliberations thereof finalized in August 2013. This is notified in the September 2013 on Ministry of Health and Family Welfare website. This National Implementation Committee for rollout has been set up, and recently a fourth subgroup has been set up to take into consideration the legal and mandatory aspects of notified electronic health records. And the categories of standards required for electronic health or mobile health and other healthcare information systems is the identifiers. Identifiers are includes the patient ID, provider ID, or the payer ID, or the health plan ID, or the pharmacy ID. The codes and terminology uses will be mainly containing like disease codes and the procedures codes. Like disease codes means COVID positive, negative, or malaria. This is what, and whatever may be the disease that they will be writing in a code. And procedures, either surgery or laparoscopy method or open surgery method, and whatever it may be, or laser treatment, whatever it may be, they will be writing some codes for the procedure. And observation codes, what are the observations found out, and the drugs that have been used, the drug codes, and the surgical consumables, like whatever they are using. So this they'll be giving some codes. And then the content and formats. The content of that information record will be like the patient enrollment registration, where they have been registered, and the patient medical records, whatever all the patient medical records, like nothing but the electronic medical records, and billing formats, minimum data sets, and the lab formats, all the things. And the messaging, they will be messaging through HL7, EDI, and then EDI factor. And the security and access control will be given the authentication control and the access control non-repudiation, privacy protection. Authentication is nothing but like the giving with the ID and password. And some healthcare informatics organizations or standards consider like the organization like it's national, and it controls the it follows the standards of information technology infrastructure for health framework, and then recommendations for IPIH framework. And recommendation the health information follows the standards of recommendations on guidelines, standards and practices for telemedicine in India. And Indian health information network development recommendations from the national knowledge. So then in case of European Committee for CEN or TC 251 EN, so these are the standards which the organization follows. And the Code of Federal Health Information Technology Standards, regulations, implementation specifications and certification criteria, and certification programs for health information technologies. The healthcare informatics or organizations and standardizations. See here, this is the American, the continued part. The American Society for Testing and the Continuity of Care Records, CCR, materials like ASTM, and then health level 7, HL7, and again more versions HL7V2X and HL7V3, HL7 clinical document architecture, EHR system function model, and HL7 and ASTM collaboration, both the collaboration of materials and health level 7 collaboration is continuity of care document CCD, and National Electrical Manufacturers Digital Imaging and Communications in Association NEMA, and medicine DCOM PS 3.0 2004 onwards, and office. These are the some of the organizations and the standards you followed, and the approved standard codes are diseases diagnosis as per the WHO's ICD-10, and clinical terminology for clinical observations as per the IHTS and procedures as per ICD-10 PCs, and disability as per WHO's ICF, and laboratory observations as per Regents Institutions Law, and messaging imaging clinical document format. Here, the model used is HL7V3 or HL7V2, or imaging by using NEMA's digital imaging or communication. So these are the standards because there should not be any conflicts uh, uh, by a particular health practitioner or anyone. They have to give minimum of this. If any image has to be uploaded, they have to follow the digital imaging or communication medicine, these DCOM versions, and the latter revisions can be included as goes on. They will be maintaining some guidelines and then standards to be followed, so in order to avoid the conflicts and to provide better patient care. And in case of the clinical data format, this HL7 CDA clinical document architecture is used, and ASTM CCS continuity of care record. And the recommended IP standards is like the DSM in case of psychiatric conditions, diagnostic and statistical manual of mental disorders, and whereas in case of NIC, NOC, and NA, is given for the nursing interventions. This is optional classification, and a CD2 US dental procedures. This is given for dental procedures, and this is optional. And unknown like Ayush, clinical, Ayurveda, yoga, Unani, terminology, treatment, Siddha, homeopathy, planning, including systems of medicine as medication details, and distinct from allopathic system of medicine, Western medicine. And the minimum data set, the minimum amount of health information required about a patient to profile a disease in a standard format. Here, the minimum data set it should include the minimum amount of health information required about a patient to process furtherly. If that should be the minimum data, or which will be considered as a basic criteria. and should also ensure that the health information is precise. It should not be very vast. It should be precise and unambiguous and acceptable to all the stakeholders. Stakeholders here, whoever are using or accessing the health records, they are called as the stakeholders here, and are represented in such a manner that they can be easily analyzed and conclusions drawn from the data. By seeing the data, we can get some knowledge, and then they can do, or they we can do draw by conclusions simply by analyzing the data. And the purpose of this is to protect the confidentiality, integrity, and availability of information. The EHR preservation, ownership, and security guidelines. Why these are have to be followed is to protect the confidentiality, integrity, and availability of the information which is maintained in the electronic health record. And again, some to divide some threat sources like accidental acts and then incidental disclosures, errors, omissions, proximity to risk areas, equipment malfunction, deliberate acts, misuse and abuse of privileges, and fraud, theft, exhaustion, crime, or any environmental threats, or fire, flood, weather, power, or any other threats, etc. And the EHR security mechanisms include the authentication, role-based access control, or data verification, transport level security, encryption mechanisms, data storage, audit log, anonymization. And the ethical and legal consideration should be data retention policy, and then patient policy or confidentiality, patient consent, quality of service, data ownership, non-repudiation, and dispute resolution. And these are the guidelines which are present in the EHS standards document in India. And the Ministry of Health and Family Welfare, Department of Health and Family Welfare, notification regarding clinical establishments, Registration and Regulations Act in 2010. Um, this is about the maintenance of health records, EHRs. The health record is very, very important. And then we have discussed the future of the healthcare system, healthcare technology, and also the health records, electronic health records, the future of electronic health records, and what are the guidelines controlling, and what is the content to be maintained, and all. So, if any doubts, please, anyone. This completes today's topic, the future of healthcare technology and future health record. Is there any doubt? Thank you. So, we'll be continuing in the tomorrow's class. Thank you. I think no one has doubts. Thank you so much. Thank you. Thank you, Lavanya. Thank you for not having any doubts. Okay, thank you. Thank you so much.
Excuse me, ma'am. I have one doubt about AI in
Yes,
tele-reporting in
sir.
radiology.
In AI, yes.
AI assisted tele-reporting in radiology.
Radiology, yes, sir.
How it's functionality basic? Some
Sir, it is like
briefly can you explain?
now actually what they will be doing. Artificial intelligence is a software having all the normal conditions. Is it clear, sir? Artificial intelligence
Okay.
is a database which will be using the cloud technology. So it
It
will
will be like a
be
preset.
preset.
It will be like a
So
preset. Okay.
preset
Okay.
means that if the doctor is having all the knowledge of normal conditions, when he is going to the all the normal pharmacological conditions, then only he can diagnose the abnormal condition, right, sir? If you are knowing the normal condition, or for a simple example, if you are knowing that the numbers continuously, we can find out the missing number page in a book. If you know to number, how to number the sequence of numbers, and if you are not finding the next number, then we can easily find out the missing number page. Correct, sir?
Okay, okay. Thank you.
Similarly, if by using the artificial intelligence, all the data which has been preloaded by using the cloud technology, when we are scanning, if any abnormality is there in our orthopedic, means skeletal system or any other thing, what it happens, it can easily diagnose, and then it will show us which is abnormal, which is even the small abnormalities we can identify. It can identify or diagnose.
It's almost similar to the cardiac calcium score software, like.
Might be, sir. I am not that much over the
Okay,
software. I am
okay,
not.
fine, fine. Okay, okay, fine.
Thank you so much.
Thanks a lot.
Thank you, sir. Thank you. Any more doubts, please?
Good afternoon, one and all. In this 1 hour, we'll be discussing about two topics. One is emergency epidemic management system, and the other one is safety system. In that, number one is emergency epidemic management system. What is meant by epidemic? It is a sudden and unexpected increase in disease or health related event in an unidentified area. So this is called as epidemic. And what are the reasons for increase in the disease condition? That is to increase and all the spread of the disease. What are the reasons? There are four reasons. Number one is geographical location. Number two, environmental condition. Number three, distribution of host population, and socio-culture behavior of people. These four are responsible for any diseases. What are the types? There are 5 types. Number one is common source epidemic. Number two, propagated epidemic. Number three, seasonal epidemic. Number four is cyclic epidemic. And the fifth one is epidemic of communicable diseases. Right. We'll see one by one. That number one is common source epidemics. What is meant by that? It occurs when a group of people get sick after being exposed to virus, bacteria, toxins, or other infectious agents. Okay, to explain this with an example, when a group of people get sick after eating the contaminated food at the same restaurant on the same day. This is one of the best example for common source epidemics. And the second one is propagated epidemics. Propagated epidemic is nothing but spread of disease, that is spread of infection from one person to another. The first one is a group of people get infected due to the exposure of toxins or viruses. And number two is propagated epidemic. It is due to spread of diseases from one person to another through air, via vector or contaminated food, and so on. This is called as propagated epidemics. Number three is seasonal epidemics. To explain this, we can explain this with an example. In a year, we have different seasons, right? During winter, many are prone to this flu, and in the spring, it is chickenpox, and in case of summer, gonorrhea and polio. So, in every season, one disease gets aggravated, right? This is an example for seasonal epidemic. And the fourth type is cyclic epidemics. And in this condition, to say particular people population, say in a particular area, people get infected by a disease and they start developing immune. So when they start developing immune, this disease gets reduced. And this is example for this is what we call a cyclic epidemics. You can see a cyclic epidemic model with a constant length of immunity is constructed for a constant population. That's below a certain threshold value, the disease dies out. That is when when the population develops immunity, this diseases gets vanishes off. And next type is epidemic of communicable diseases. How communicable diseases are spread? Like what through water, poor sanitation, and when there is contamination food or air. Through these, the communicable diseases spread, and particularly through water supply, this communicable diseases gets spread. Cholera is one of the example for epidemic of communicable diseases. Right? How can we manage these epidemics? And when we speak about this management of epidemics, it's a step-by-step process, right? That is starting from reviewing of epidemics that has occurred in previous year to prevent such epidemics. These are the steps involved in management. In that, number one step is forecasting of epidemics. That is reviewing on previous year, what have happened in last year or for the last 3 years, like that. And second one is investigation of epidemics. That is after reviewing, you are undergoing investigation process. And after investigating, you are concentrating on how to control this epidemics. That is your third step. And fourth step is how prevention of epidemics. That is after reviewing, after you this one investigating, and you take necessary steps to control it. And always there is a proverb, right? Prevention is better than cure. So likewise, that fourth step will be how to prevent such epidemics. We'll see one by one. Forecasting of epidemics, and it is a early warning system that is prepared to meet the challenges. So on that threats of epidemic, that is what are the challenges that is occurring in epidemic, we are collecting the data. That is called forecasting of epidemics. And it is more appropriate in case of cyclic and seasonal epidemics, because in summer itself we'll be collecting the data. That is in winter what type of disease is going to spread, so we'll be start collecting the data. right? Also in previous year, how many people have affected, which disease was predominant, so we'll be collecting the data. And also one more thing, by forecasting one cannot totally prevent, that is, by reviewing process we can't stop this epidemic, we can't prevent it, definitely it's going to occur. But one thing is for sure, that we can control the severity, and at the same time we can control the spread to the other areas. So that is, number of population that is infected can be reduced by this process. How we are doing it now? By three ways. That is, number one is concentrating on how many people have infected and how many are newly infected. You're taking a review on it. That is number one. Number two is whether the disease condition causes only the symptoms, or it leads to any death condition, death rate, it leads to any death rate. That one we are concentrating it. And third thing is which age group, whether it affects the geriatrics or pediatrics, or which it affects, which people it affects, that is the female or male. The two, in which age group only the symptoms are seen prevalent, or in which age group the death rate occurs. So studying on these all things includes the forecasting the epidemics. And the details or the data that we have collected, that is, we will be collecting on month wise and also for year wise for the past 3 years. And then the collected data will be plotted on the graph for future reference. And based on plotting this on graph, we can estimate whether the cases are grouped or clustered. And the next second step is investigation of epidemics. That is, in spite of accurate forecasting, a epidemic cannot be aborted. So the next step will be investigation should be started to confirm it. How we will do? It includes some 11 steps. The first step is verification of diagnosis. That is, when we first investigate, now there is a spurious data. There are chances of some misconduct or miscollection of data. So again, the verification should be done. That is through clinical examination. That is through orally. That is whether they have developed the symptoms or not. But better way is for clinical examination. That gives the accurate result. How many people are affected, how many are developed the symptoms. By laboratory testing we can do it. That is the first step, verification of diagnosis, right? Second one is confirmation of existence of epidemics. When we say that, that is when we'll say that the epidemic has occurred, that is, we will estimate a particular number of cases will occur, but actual cost, that is actual number of cases, should exceed the expected frequency. That time we can confirm that there exists a epidemics, right? And third one is defining population at risk. That is, we'll be collecting the data at age wise, at gender wise, and then we'll be sorting out which age group is vulnerable to this disease, whether it is geriatric, pediatric, or middle age group people, or whether it is male or female. That is, we'll be defining population at risk. Next is rapid search for all cases in area. That is, we'll undergo medical survey. That is, not only this disease has arisen only in a particular area or to other area. So we will be collecting a survey. That is, we'll be making a survey in all places, and we'll be reporting whether which area the disease has spread, or in which area the number of cases is high, right? Next one is analysis of data. That is, based on the this one information we have collected, we'll be sorting out. That is, based on age group, place, time, and we'll be sorting out and we'll be analyzing the data. And formulation, next step is formulation of hypothesis. That is, based on the collected data, we'll be creating one hypothesis. That is, which organism is responsible for diseases, what are the symptoms, how can we prevent it. So we'll be formulating a hypothesis. And then this testing of hypothesis, that is, after formulating the hypothesis, we'll be undergoing, that is, we'll be evaluating the hypothesis that we have formulated. Next is evaluation of ecological factors. That is, the disease is spread through, we have seen, right, last time, means in previous slide, communicable diseases, that is through water, sanitation. Likewise, in environmental factor, which are all contaminated, whether water, there is any pollution in water or soil. So we will be evaluating the ecological factors. Next is expand the search in other areas. That is same like that. not only we are concentrating on particular region, but also the neighboring and other area also. That is the places, the people will migrate from one place to another, right? So wherever they go, they will be analyzed. They will be carrying out the survey and analyzing whether the disease is spread or not. And then last step is writing the final report. This is the main step, because the main work of this investigation team is to collect all the data, and they need to segregate it, and they need to file the report. That is a causative organism, mode of transmission, their incubation period, their treatment, and also how they can be prevented. Whether if the person is infected, or whether they have to undergo quarantine or isolation, they have to make it or not. That details also should be they have to return it. They have to write it, and also any immunization is required or not. That thing also they have to make a final report and submit to healthcare team and also Ministry of Health. These are all the steps involved in investigation of epidemics. And then third step is to control of epidemics. How to control an epidemics? If one person has to control this epidemics now, they should know the causative organism, dynamic of disease transmission, and mode of transmission, whether it is through direct contact, indirect contact, vehicle of transmission, and so on. And then also route of transmission, whether it is through skin, blood, urinary tract, or respiratory tract. Right. What are the principles involved in this one, control of epidemic? There are three principles. One is removal of source of infection. That is, say for example, in case of dengue, what mosquito bite and controlling of Aedes mosquitoes. That is removal of source of infection. Next is prevent transmission. How we can prevent it? That is where protecting ourselves from mosquito bite. Next is vector control measures. These are the three principles involved in control of epidemics. Next one is removal of source of the, that is in principle. First one is removal of sources, right? It involves treatment infected. What are the infected cases? They are treating it, and destruction of reservoir of infection, and removal or correction of source of infection. Next one is prevent. How to prevent this transmission? That is first isolating the infected cases, and improving a personal hygiene condition by washing hands, use of sterile supply, and proper disposal of vomits, and improve environmental sanitation, and also tracing on neighbors or family members who have contact with infected person, and also screening of suspected cases. That is where they have whether the person has migrated to the infected area, so that person will be undergoing screening process. And then quarantine of migrated cases. After screening it, they are undergoing quarantine process. And then giving education, training programs, and health education regarding this epidemics. And also increases resistance of suspects through immunization. That when if the disease condition is to this one geriatric patient, whether they can be prevent this disease by immunization, by giving vaccine, they can prevent or not, right? And also who will be treating frontline workers, that is healthcare workers will be treating the diseased people, right? So they also should not get infected. So in that case, prophylactic drugs are given to frontline workers. By these ways we can prevent the transmission of disease. Next is vector control measures. That is prevent the breeding of mosquitoes, flies, and fleas, and then destruction of adult vectors through insecticides and pesticides, and personal protections like prevent bite, use mosquito nets, and use hot food and filtered water, and increase the personal hygiene, and also improving the environmental sanitation. And the last but not the least, that is preventive measures. How can we prevent a disease? By three ways. First one is personal measure. How can we prevent ourselves? That is by resisting our body by immunization and by taking nutrient diet, and changing our food habit. That is changing our food habits, instead of looking for fast foods, and a healthy food, and also regularly practicing yoga and exercise, and pollution free atmosphere, and giving away addiction, which are the risk factors for any diseases. And second one is environmental measures. Environmental measures includes clean potable water supply, prevent open air defecation, proper disposal of garbage, adequate sewage system, lightened and well ventilated houses, and also regular health education to public through mass media, group meetings, seminars, and workshops. By this way, we can prevent a epidemic. This is all about an overview about management of epidemics. And the next topic is about safety system. What is meant by safety system? That is, it is a series of process that are involved in an organization which is designed to protect against a risk. That is, for a safety working environment, that is to protect the workers, certain process steps are designed. That is called a safety management system. When we speak about healthcare team, the safety management system particularly focuses on patient safety management system. Right. What are the key attributes of a successful patient safety management system? That is, it provides systemic, explicit, and comprehensive process for managing the risks that patients face in a healthcare settings. And what are the elements for a successful um, patient safety management system is number one. First, this assessing the hazards that will occur in healthcare system. Sorry, healthcare system, and specifying how these hazards are to be managed. That is, first we'll be assessing what type of risk factors involved, that what are the hazards that is involved in healthcare system, and taking necessary steps in nullifying this hazards. And also in the last condition is that though we take necessary step, in some condition it may fail. Even in that fail condition, how the team manages to control this hazard. These three elements play a significant role in developing a successful patient safety management system. Next, how come you know that this patient safety management is successful? By seven criteria. This seven criteria is going to repeat again. So we'll be concentrating only on this seven criteria. This seven characteristics will define whether this organization has a patient safety management is successful or not. Number one is demonstrated senior management commitment to patient safety, and number two is framing the policies for patient safety as well as for effective operating procedure. Number three, fixing or appointing a person who's accountable for the patient safety. The fourth one is necessary steps taken to identify and investigate on patient safety risks. And the next fifth point will be how to manage, which that is, in previous step we have identified and investigated what kind of hazards will occur at healthcare place, right? So how to manage such hazards, that will be the fifth step. After that, reviewing on, that is, for managing they will be practicing some kind of procedures, right? Whether that procedures are working properly, that is process of review and evaluating that has been existing to manage this hazards. And last one is training and education program for the staff and also for patients regarding the patient safety. These are the seven characteristics that will determine whether the patient safety management system is successful or not in an organization. Next, who are all responsible for this patient safety management? That is, at highest level, the states, union territories, commonwealth, or through legislative and regulatory framework, that all work through that all working that we all work in healthcare services. And the people, there are four people who's responsible for in managing patient safety management system. Number one is governing bodies or CEOs. Number two is managers or clinician managers. Number three is clinicians, and number four is consumers. These four people play a major role um, that is, these four people are responsible for this PSMS. That number one, governing bodies and CEOs. That is, they are responsible for an area or a network that is usually based on more than one facility. That is, they mainly concentrate on facilities and services, right? That is, we have studied the seven criteria, right? In seven characteristics that only will be explaining one by one. In the first one is demonstrate commitment to patient safety. The role of the CEO is to they have to actively involved in developing patient safety management system. That is, they should develop some steps. They should create some programs in order to educate the staffs as well as the patients, so that they can understand what are the steps involved and what are the process involved in patient safety. Next one is regarding agreed policy. That is, the organization head of the organization is responsible for creating policies to prevent that is to help the patients, and also ensure that the patient is aware of these policies. And also they should ensure that the staffs are familiar with the policies that is framed by the organization. Next step is organization. That is, the organization should fix a particular person who's accountable for patient safety, and also ensure that all the staffs and patients should understand the accountability structure works. That is how it is carried out. Next is systemic approach to identify the patient safety risk. That is, how to identify means through feedback. That is, patients should come voluntarily to give feedback regarding their the problems faced by them. So that this CEO, what they have to do, they have to appoint the staffs and have to collect the feedback, and based on that they have to investigate and submit the report. That is, these kind of risk are faced by the patients. So how come we nullify, or how can we rectify these issues? These are all the roles of the CEO. And one more thing is, they should be the feedback that is collected from the patient, it should be confidential. Next, a systematic approach to manage all sources of patient safety risk, which means they have collected the data, right? So they have to undergo, we have to analyze it, and then necessary treatment should be framed. That is, use treatment plans to eliminate or avoid or reduce the risk. That is based on will be by collecting the feedback from the patients, they'll come to know what are the risks faced by the patients, and necessary steps should be taken to rectify it. And next step is, after framing the process or treatment, whether it is working properly or not, they should cross verify it periodically. This is the role of CEO. The next role is about managers, is from managers or clinician managers. What is their responsibility? They are responsible for facility and treat department in facility. Actually, they mainly focus in procedure in support of organization policy. And this manager should be aware of the policies involved, and also what are the process steps involved in management of patient safety. This is the role of the managers. And also they should report regularly and receive timely feedback, and also they should get adequate resources from the management. Okay, this is all the role of managers. Next is about this policy. This manager role of the managers in agreed policy is they will be framing it, and also they will be cross verifying it, and also they should educate the staffs. That is, they should make understand the staffs and well as the patient. Okay, and ensure that staff understand the patient safety management and how it applies to them, and also ensure that the patients are aware of this patient safety management system, and also how it applies to them, and also encourage both the staffs and patients to participate in patient safety management system. Next, there is a single point of accountability. That is, they should clearly define which person is responsible for patient safety, and how they should educate the staffs and also patients regarding how the data will be collected, and finally to whom the data will be submitted. This all details should be clearly explained to the staffs, and also ensure that all staff understand how the accountability structure works, and also ensure that patients are aware of this accountability structure. Next is identification of patient safety. That is, this manager should appoint the staffs and they should collect the information, that is the patient from patients, they will be collecting the feedback, right? That collected feedback should be investigated. For that, specific number of means required number of staff should be appointed, and they should monitor their work, how they are collecting it, how they are analyzing it, and have procedure in place to maintain that is, after collecting data, all the data should be confidential. It should not be let it out. Can provide timely feedback to staff and patients who report the risks. Okay. Next is systematic approach is taken to manage all sources of patient safety risks. That is, after this one, collecting what are the types of hazards are happening, it necessary treatment and plans are implementing it in order to manage such hazards in hazards faced by the patients. That is, use of treatment plans to eliminate, avoid, or reduce the risk. And also, they should ensure that patients as well as the staffs are aware of the treatment that is available to control these hazards. Next, use of organization as a process to evaluate how patient safety management is working. That is, after framing the what you call this system, that is processes treatment, whether it is working condition, or whether any improvement is required, working on it. This is the next role of a manager. Next is arranging educational program and training program regarding patient safety, both to staff as well as patients, and also encouraging them to participate such in such programs. And this, that is, last 3 points will be same for all groups. Next group of people responsible is clinicians. They are responsible for day-to-day practice within this sphere of work. Yes, what are the checklist? In case of senior management, they should be aware of, that is, clinician should be aware of senior management involvement in patient safety management system, and familiar with it, and also how it applies to the staff as well as to the patient, and also actively encouraged to participate in patient safety management system. And next is about this one, policy. That is, they should ensure that patient safety policy and procedure is aligned with other risk, that is, not only with particular hazards but also with other hazards also, and also ensure that it is well explained to patients as well as to the staffs. Next is about single point accountability. It is nothing but same, how which person is responsible for patient safety accountability, and how the data are collected, how they are investigated, and how this collected data are kept confidentially. These all, this point will speak about it. Next is a systemic approach is taken to identify this patient safety risks. That is, active participation of staffs in investigating the reporting system. That is, the patient, that is, the staff should have full involvement in collecting the feedback. So collecting feedback from patients should be very friendly. That is, if what are the problems you have faced, what can we do to rectify it. So there should be a friendly interaction, and also collecting data should be kept confidential. Also receive timely feedback from the reports. Report of this. Next is a systemic approach is taken to manage all sources of patient safety risks. That is, the patient as well as the staff should be aware of status of each patient safety hazard that has effect in their area, that is, in the effect in their organization, and participate in evaluating treatments to confirm that they are working. Right. Next is to evaluating the patient safety management system. That is, the procedures and all the protocols should be periodically evaluated. That is, any improvement is required or not. Likewise, and organization has a training and educational program. Yeah, I said right. The last three steps will be common for all. They will be encouraging and framing um, many workshops and training programs both for patients as well as to the staffs. And next one is about the consumers, that is patients. Consumers also have the responsibility to be active participant in patient safety management system, right? In that, that is a consumer should know what are the steps involved, what are the hazards occurs a at a organization, health organization, and what are the policies that is involved, and also what are the safety system that is available in organization and how it is applicable to them. It's a responsibility of the consumer to know it, and it is a responsibility of organization to educate the patients. Next is about policy. That likewise, how it is responsible for the organization to educate the patient. Likewise, a patient should have the responsibility to know what are the policies that is applicable to them. How can they get benefited through the policies that is framed by the organization. Then next is point of accountability. That is which person is going to collect the data, and how the collected data, how they are going to take into the next step. That details should be educated to the patient, and it's responsibility of the consumer to know it also. Next is a systemic approach is taken to the identification of patient safety risk. That is the patient should be aware of feedback. That is they shouldn't worry about that whether if they have given their feedback, their data will be correct or not. No, they should be uh, come voluntarily to give feedback or the problems faced by them, so that it can be nullified, it can be rectified. And also, and they should understand that their data will be kept confidential, and receive feedback when you that is when the report is risk. Next is a systemic approach is taken to manage all sorts of patient safety. That is, they should be aware that the treatment and the process or the protocol that has been framed are regularly evaluated. They should know it, and these consumers may be invited to participate in investigating, to identify the hazards or risks that occurring at health organization. And also they might be participated in developing the treatment plan in order to eliminate or avoid or reduce the risk. And they should be aware of patient safety hazards. That is, what kind of hazards can be possible, that is they can be faced. That details also it's a responsibility of the consumer to understand, to know it. And, and next one is organization. Organization has a process to evaluate how the patient safety management is working. That is the framed processes evaluate. The organization will periodically they'll evaluate the process. So that knowledge should be given to the patient. That is, what are the changes that has occurred, how they have improved it. That detail should be known to the patient, that is consumer. Next is the acute care facility in which you are being treated, that is the patient being treated. That is training and education program. They should, if the organization or the healthcare team calls the public and gives them education regarding how what are the hazards that will occur, how can they protect themselves from such hazards. If the healthcare team is organizing it now, they should, with full involvement, the patient should come voluntarily, and they should learn it so that it will help them in future. This is some brief about safety system and epidemic management. Thank you. Yes, any doubts? Thank you one and all. So we'll just have a revision. What are the topic we have covered today? That is the first topic we have discussed is emergency epidemic management system. In that, we have seen what is meant by epidemic. That is when there is a sudden increase in a disease in a particular area, it is called as epidemic. And the reason for epidemics are for there are four reasons. And then we have seen the five types of epidemics, that is common source epidemic, propagated epidemic, seasonal epidemic, cyclic epidemics, and epidemic of communicable diseases. These are the types. And then we have seen one by one what is common source epidemics, propagated epidemics, next is seasonal epidemic, next is cyclic epidemic, and then followed by this one communicable disease, epidemics of cyclic epidemics, and epidemic of communicable diseases. Next is how can we manage the this epidemics. That is, it is a step by step process. It involves four steps. Number one is forecasting of epidemics, investigation of epidemics, control of epidemics, and prevention of epidemics. We have seen that is we have seen a definition. What are the types and how we can manage such epidemics. That forecasting is nothing but reviewing in, that is what are the diseases, that is collecting the data of diseases that has occurred in previous year. That is how many people have infected, what kind of diseases occurred, how many people have affected by the disease, which age group is vulnerable to such disease. Collecting such data is nothing but forecasting of epidemics. And this method involved is there are three methods. One is collecting the data, how many are infected, what are the new cases, and whether the disease condition causes only the symptoms or any mortality rate. And also concentrating on which age group is affecting and which gender, whether male or female, it is affecting a lot. And the collected data are plotted, that is the data are collected month wise and also year wise for past 3 years, and then plotting it in a graph so that we can define it whether it is the disease is grouped or cluster. And the next step is investigation of epidemics. It involves some series of steps, that is verification of diagnosis, confirmation of existence of epidemics, and defining the population at risk, which population is vulnerable to such disease, and rapid search for all cases in area. And the collected data has been analyzed, and based on the collected data, hypothesis is formulated, and then formulated hypothesis has been tested, and also evaluating the ecological factor, and expand the search in other areas. That is only in particular area the disease is spread or it is infected, or other area also. And also based on the data collected, and the investigation team will create a final report and will be submitting to healthcare team as well as to Ministry of Health. The next step is to control the epidemics. How can we control? By knowing the causative organs, how it is infected, what are the symptoms and their mode of transmission and route of transmission too. And how can we control it? That is by removing the infected, that is by treating the infected cases, and also by how can we prevent it now? By isolating the deceased people, and also quarantine the people who are migrating to the this one infected place, and also screening the suspected cases, and improving the environmental sanitation, and also immunizing the people group, a set of people who suspected for to infected by the disease, and also giving prophylactic drug to frontline ones, that is the healthcare team who are treating such diseases. And by how can we control it? By controlling the vector, that is preventing the breeding, and also by using insecticides and pesticides, controlling the adult vectors, and also providing and also improving personal hygiene, and also improving environmental sanitation. And last step in management of epidemics is preventive measure. That is by personal measure, that is by improving, by immunizing our body through diet, regular exercise and yoga, and also pollution free environment, and also giving away the addiction. Next is through environmental measures. through environmental measure is that is supplying clean water, and prevent open air defecation, and proper disposal of garbage, and proper sewage system, and good lighted and well ventilated houses. And also educating the public through group meetings, seminars, or workshop regarding the epidemic, that is regarding the disease. The next step what we saw is safety management. In safety management, it is a steps or the process that is developed by the organization in order to ensure the safety of the workers in an organization. When we speak about healthcare system, this safety management particularly concentrates on patient safety management. So excuse me, in order to ensure the successful patient safety management, the key elements involved in defining successful patient safety management includes discovery and assessment of hazards of particular, that is what kind of hazards will be occurring at workplace, that is in healthcare workplace, and how can we manage it, though we take necessary step in managing such hazards. What are the immediate steps are taken to rectify such failures? So this all will deal with for successful patient safety management. And there are seven criterias, that is seven characteristics that is responsible for a successful patient safety management. Number one is demonstrates senior management committee, that is organizing, a committee is formed with senior person in order to frame the policies, and also to improve the that is to educate what kind of hazards occurs, and also how to manage such hazards, and also framing the policies that is helpful for both for patients as well as staffs, and how come this policy is used for the patient. And next is appointing a person who's accountable for patient safety, and what are their roles, and how the data are collected, and how it is further is used. And also steps taken in identifying and investigating the patient safety risks, and managing, and based on the identification of this patient risk, and taking necessary steps, and framing policies and procedures for treating such hazards. That will be the next step, followed by after framing the procedures and investigation processes, we have need to periodically, the organization should evaluate whether such process or in working, that is any improvement is required or it can be continued or not. And also encouraging the patients as well as the staffs to train them regarding this patient safety management. And there are four bodies um, which is responsible for what patient safety management system. That is, number one is governing bodies or CEOs, managers or clinical managers, clinicians, and consumers. And these four people are responsible, and based on this, and these four people will work on this seven criterias for effective patient safety management. This is an overview. Any doubts? Thank you.
Good afternoon.
Good afternoon, sir.
Am I audible?
Yes, sir.
Is my slide visible?
Yes, sir.
Is my slide changing?
Yes, sir. 100%.
Okay, thank you. So, good afternoon. Yesterday, we had dealt about hospital waste management. So, today, in continuation of the same, we are going to deal about the treatment and disposal technologies. So, hospital waste can be treated and disposed by 6 methods. Number 1 is called incineration. The second method is called chemical disinfection. The third method is wet and dry thermal treatment. The fourth method is microwave irradiation. The fifth method is land disposal. The sixth method is inertiation. So yesterday we saw about this incineration, high temperature dry oxidation process that reduces organic and combustible waste into inorganic incombustible waste, resulting in significant reduction in waste volume and weight. So these and all are the advantages of this treatment and disposal technology for hospital waste: incineration, where you burn at a high temperature. So when waste is incinerated, heat is generated, gas is generated, and ash is generated. What are the types of incinerators? For infectious waste, we make use of double chambered incinerator. If double chambered incinerator is not affordable, it's very costly, then the hospital can go for a single chamber. Apart from this, they can make use of rotary kilns for genotoxic waste. The next method of treatment and disposal of hospital waste is by chemical disinfection. Chemical disinfection is commonly used for treatment of liquid infectious waste such as blood, urine, stool, hospital sewage. So the chemicals that are added kill or inactivate the pathogens. The third method is called as the wet and dry thermal treatment method. So in this wet thermal treatment method, it is also known as steam disinfection. It is based on exposure of the infectious waste to high temperature and high pressure steam, similar to the process of autoclaving. It is inappropriate for treating anatomical waste, chemical and pharmaceutical waste. There is a technology called a screw feed technology, where the dry thermal treatment in which waste is shredded and treated in rotating auger. 80% of the volume is reduced, and it is suitable for infectious waste and sharps. The next one we are going to deal is called microwave irradiation. Microwave in the frequency of 2450 megahertz with a wavelength of 12.24 centimeters is used to destroy the microorganism. Water contained in the waste is rapidly heated by microwave, and infectious components are destroyed by the heat conduction. The next one is a very common method. It is called as land disposal. In this, there are two methods. One is called as open dump. Another one is called as sanitary landfill. In open dumps, the risk for public health is high. In sanitary landfills, it is designed and constructed to prevent contamination of soil, surface, groundwater, and direct contact with public. So sanitary landfills are far better in hospital waste management. The next one is called inertization. It is a process of mixing waste with cement and other substances before disposal in order to minimize the risk of toxic substances migrating into surface water or groundwater and to prevent scavenging. The ratio that is usually used is 65% waste, 15% lime, another 15% is cement, and 5% water. So in this proportion, the hospital waste is mixed with cement and disposed. How the different categories of medical waste, hospital waste, is being treated and disposed of. Category 1. So this category 1 is human anatomical waste, that is human tissues, organs, body parts. So they and all are incinerated or they are buried deep. The category 2 is animal waste. Animal tissues, organs, body parts, carcass, bleeding parts, fluid, blood, experimental animals used in research, waste generated by veterinary hospitals and colleges, discharge from hospitals and animal houses. All this are either incinerated or deep buried. The third category is microbiology and biotechnology waste. So the waste from the laboratory cultures, stocks, or specimen of live microorganisms or attenuated vaccine, human and animal cell culture used in research, infectious agents from research and industrial laboratories, waste from production of biological toxins and devices. So all these waste, they are called category 3 waste. They are either autoclaved or microwaved or incinerated. So you can see in this all this first, second, and third, all the first 3 categories, they can be incinerated safely. The fourth category is the sharps that cause the puncture and cuts. So both used and unused, both of them form this category 4. So they can be disposed of by autoclaving or by microwaving or by disinfecting with chemical treatment. Category 5 is discarded medicine and cytotoxic drugs. So they can be incinerated or can be landfilled. The soiled waste, that is the cotton dressing, plasters, liners, bedding material. So when they are contaminated with blood, they are either incinerated, autoclaved, or microwave. The solid waste is disinfected by chemical treatment or is autoclaved or is microwave over. We have the category 8, that is liquid waste. Waste generated from a laboratory, waste generated while washing, cleaning, housekeeping, and disinfecting activities. So all this liquid waste, they are disinfected by chemical treatment and they are discharged into drains. The category 9 is called as incineration ash. It is ash from the incinerator of any biomedical waste. That is the waste of waste. This is disposed in municipal landfills. The category 10, that is the last category, that is called chemical waste. The chemicals used in the production of biologicals, chemicals used in disinfecting as insecticide. So all these chemicals are made to undergo a treatment of suitable chemicals and then discharged into drains, or it is securely landfilled. So here, based on the biomedical waste category, hospital biomedical waste is classified into 10 categories. And in that, the first 3 categories can be safely treated and disposed by incineration. The next 3 categories, 4, 5, 6, can also be safely disposed by incineration. Category number 7, 8, 9, and 10. They can be incinerated by chemical treatment, autoclaving, or microwaving. So with this, we cover or we complete this portion on biomedical waste. The next thing we are going to see is what is a case study. So in your examination, there are chances that you will be getting at 20 marks question on case studies. So students, is my slide on case study visible?
Yes, sir.
Yeah. Thank you. Okay. So is the slide on case study changing?
Yes, sir.
Thank you. Thank you. Thank you. So in your examination, there are chances you will be getting one question on case study. So I will just give an overview of what is a case study, and then I will give an overview of the case studies of a hospital. So you will have to tailor make your answer individually so that you get very good marks in a case study. So case study, you cannot write from some notes or from some books. So it will be better if you can tailor make it with your experience. So we will see what is a case study. To graduate students and researchers unfamiliar with case study methodology, there is often misunderstanding about what a case study is and how it has to be performed. Case study is a form of qualitative descriptive research that is used to look at individuals, a small group of participants, or the entire group as a whole. This qualitative method of study emphasizes detailed contextual analysis of a limited number of events or conditions and the relationship. So we will define a case study. Number one, it is a systematic inquiry into an event or a set of related events which aims to describe and explain the phenomenon of interest. It refers to the collection and preparation of detailed information about a particular participant or a small group. It is an in-depth study of a particular situation rather than a sweeping statistical survey. When is a case study appropriate? When the focus of the study is to answer how and why questions, how it is done, why it is done. Then a case study is appropriate. So it is not possible to manipulate the behavior of those involved in the case study. So in a case study, what may be revealed? A researcher can examine contemporary real-life situations and provide the basis for the application of ideas and extension of method. A case study may not give an answer to a question completely, but it will give indications that allows further elaboration and hypothesis creation on a subject. So why do we perform a case study? To improve the learning experience. So they are different from the usual lectures and assignments because they will have to participate and know the difference between knowing what to do and knowing how, when, and why to do. What are the case study applications? Case study can be used as a teaching method. It provides a professional environment. So the students are engaged with each other and with each other's idea by ascertaining something and then having it questioned, challenged, and thrown upon them so that they can fill on what they hear and they refine and what they say. We will see the designs of case study. Broadly, you can define a case study into two types: single case design and multiple case design. So in a single case design, the events are limited to a single occurrence. However, the drawback of this design is its inability to provide a generalizing conclusion, in particular when the events are rare. The next method is called a multiple case design. This can be adopted with real life events that show numerous sources of evidence through replication rather than sampling logic. Now we will see the types of case study. The first one is called as explanatory. The second one is called as exploratory. The first one, explanatory, explain. When we seek an answer to a question, sought to explain the presumed causal links in real life interventions that are too complex for the survey or experimental strategies. Next, we will see exploratory. This type of case study is used to explore those situations in which the intervention being evaluated no clear single set of outcome. We will see an example. The former one, analyzing a web-based e-commerce learning community, a case study in Brazil internet research. In exploratory, we can give an example, an observational study of the development of a nurse-patient relationship. The second one is very sensitive. Then we have a descriptive case study. So totally there are 7 types of case studies. We have seen the first two, explanatory and exploratory. The name itself suggests the meaning for these two, explanatory and exploratory. The third one is descriptive. This type of case study is used to describe an intervention or phenomenon and the real life context in which it occurs. One example is coping with menstruation. Understanding the needs of women with Parkinson's disease. The next one is multiple case study. This enables the researcher to explore differences within and between cases. An example, innovative community services for rape victims. An application to multiple case study methodology. The next one is intrinsic case study. The researchers who have genuine interest in the case are alone taken. So usually such types of case studies are primarily taken because the case represents other cases. Example, we do things together, a case study of couplehood in dementia. Next is instrumental case study. It is used to accomplish something other than understanding a particular situation. Like for example, components of observable behavior that indicates potential for patients' violence in emergency departments. The last method is called collective. It is similar in nature and description to multiple case studies. The role of stress in the professional life of school music teacher, a collective case study. So we have seen the 7 types of case studies. First one is explanatory, second one is exploratory, third one is descriptive, fourth one is multiple case study, fifth one is intrinsic, the sixth one is instrumental, seventh one is collective. Now we will see what are all the advantages and limitations of case. The primary advantage of case study is that it provides much more detailed information than what is available through other methods, such as survey, Case studies also allow one person to present data collected from multiple methods. Case studies can be lengthy because they provide detailed information about the case in narrative form. It may be difficult to hold a reader's interest if it is too lengthy. There is one disadvantage. Case studies are considered as less rigorous. It is a qualitative research in general. In some cases, it may not be systematic. So there could be bias. The second thing is a case study cannot be generalizable. Studies which are over generalized then it is not considered in many situations. What are the steps involved in a case study? So when you perform a case study, you should know these steps. These steps are very, very important. Number one is plan. We should identify the stakeholders who will be involved. Brainstorm a case study topic, considering the types of cases and why they are unique or of interest. Identify what information is needed and from whom. Identify the documents needed. List the stakeholders to be interviewed or surveyed at national level. Determine the sample requirement at beneficiary level and national level. Ensure that the research will follow international and national ethical research standards, including review by ethical research committee. So once we plan how to carry a case study, the next one is we have to develop the instruments. So we will have to develop the interview protocols. So they ensure that the interview or survey is consistent. Where necessary, translations are required for the questionnaire. It should be transferred into the local language. The third one is we need to train data collectors. After training the data collectors will collect the data. They will interview the stakeholders, survey the stakeholders. They will seek informed consent of each respondent, either in a written form or a documented oral form. Always written form is better. If the respondent has consented, then the survey or the interview will be conducted. The next step after collecting data is to analyze the data. For analyzing the data, we need to review all the relevant documents, and on analyzing the data, the report that we get, the findings that we have, we should write it as a report. We should obtain feedback, we should revise, and then we should disseminate. So we have seen the steps of case study. So when you perform a case study, you should ensure that number one, you plan. Number two, you develop the instruments required for the instrument interview survey. Number three, you should train the data collectors. Number four, whatever data is collected, that will have to be analyzed and the report's findings should be disseminated. What are the potential sources of information? The case studies typically rely on multiple sources of information and methods to provide as complete a picture as possible. The information sources are project documents, project reports, monitoring visits, mystery client reports, facilities assessment reports, interviews, questionnaire, evaluation reports, observation, and the like. We will now see what are all the elements of a case study. The elements of a case study typically describe a program or intervention and they address a particular problem. So when you are carrying out a case study, first is you have to identify what the problem was. You can practice by explaining why the problem is important. You should. First, it is essential to identify what the problem was. First, identify the problem. The next one is the steps taken to address the problem. What was done? The activities, intervention, inputs, where, by whom, for whom. Next is the results. What are the results of our intervention? What are all the unique results? Then is the challenges and how the challenges were faced. Next is beyond result. That means, is the result sustainable? And the last one is lessons learned. What are all the lessons that we have learned from this case study? The next very important part is how case studies are presented. So there is a lot of flexibility in presenting a case study. There is no specific format. So a uniform format is just discussed here with. As applicable, it can be taken. The first chapter in case study presentation is introduction and justification. Why this research topic was selected. The next one is methodology, how the methodology of survey was carried out. The third one is how the process was carried out. Data collection, how the data was collected. The fourth one, did we have any assumptions? And the last and very important one is, are there any limitations in this method? Then we will have to describe the instruments that we use to collect the data. what samples were used, what is the period of data collection, what was the problem and how the problem was addressed, what was the result, what were the challenges in meeting the result, after results what was the lessons learned. And then we conclude and proof is presented as appendix. So with this, we complete how to carry out a case study. So there are two types of case studies. One is called a single case study. Another one is called as multiple case study. Again, there are many different types of case study. One is explanatory. Another one is exploratory. The third one is descriptive. The fourth one is multiple case study. The fifth one is intrinsic. The sixth one is instrumental. The seventh one is collective. So there are 7 types of case studies. So advantages and limitations we have seen. Now we will see the steps involved in a case study. First, we need to plan how to carry out a case study. And as per that plan, we have to develop the instruments. We have to train the data collectors. We have to collect data. We have to analyze the data. We have to disseminate what we have found. So where is the information available? So information will have to be mined by visiting, by taking an interview with the client, framing a nice questionnaire, conducting a survey. So in a case study, when it is being presented, marks are given for the problem. Next, marks are given for the steps taken to address the problem. Then marks are given for the results and for the challenges, how they were met. And marks at the last is given to lessons learned. So with this, we complete how to carry out a case study. So now I will just highlight about a hospital as such, as a case study. So this is hospital facilities management itself, the whole subject, what we have been dealing for the last 10 hours, that itself as a case study. So my dear active participants, is my slide on hospital facilities management a case study visible? Dear participants?
Yes, sir. Yes, sir.
Thank you. Thank you. Is my slide changing?
Yes, sir.
Thank you. Thank you. See, in the examination, they can ask you a case study of a particular service provided by the hospital facilities management. So when you answer that, you will have to tailor make your answer. So that is why in this presentation, I am going to deal with the entire hospital, all the facilities available in the hospital management. So you can take any one and present it in the examination, but here I am going to deal the entire hospital. So what's a hospital? A hospital is an institution for providing healthcare treatment to the patients with specialized staff and equipment. So how do you generally divide a hospital? You generally divide a hospital based on the bed strength. So the Medical Council of India has the authority to define the categories of a hospital. So according to the Medical Council of India, under category A, 25 to 50 beds. Category B means 51 to 100 beds. Category C means 101 to 300 beds. Category D means 301 to 500 beds. And category E is 500 to 700 beds. How to select the site for a hospital? So this itself is a case study. Selection of site of the hospital. So imagine you are a philanthropic organization and then you want to start a hospital exclusively for geriatric patients, the patients, especially for the patients who are suffering from dementia. So that hospital location should be in such a way that it is in a quiet place, because it is geriatric, it is people with problems. So based on the bed strength, we should arrive at the area required. Always we should have an area reserved for future expansion. When we select a land for the hospital, there must not be any contamination. There must not be any contamination nearby. There must not be any loss to amenities. So these 5 points are taken into consideration when selecting a site for a hospital. Number 1, it should be quiet. Number 2, the area should be available as per norms. The third one, there must be area separately available for expansion. There must not be any loss to amenities. And number 5, it should not be a contaminated land. So the directions on which the hospital rooms are set up. So scientifically, they also have a backing. The treatment rooms are in the northwest and northeast direction. The nursing wards are usually on the south to southwest direction. And the special rooms, they are in the north direction. So here I have given you a tabular column where you can see the connectivity between areas. In that I have mentioned the 3 symbols. One is circle. That means very good connection is required. Another one is, we can call it the trapezium type. That means good connection is sensible. The third one is square. So this connection is desirable. So if you look, the nursing area and the intensive care area, the connection is desirable. Whereas the operating area and the intensive care area, the connections must be very, very good. The intensive care area and the sterilization area should have a sensibly good connection. The maternity area and the examination area should have a very good connection. So like this, the various areas in a hospital and the connectivity can be classified into very good, good, and desirable. Now we will see the space requirements in a hospital. Here, PA means productive area. So for waste disposal and for supply, we need 40 to 80 square meters of planned area per planned bed and carry area. So the supply and disposal area is totally based on the bed strength. So usually it is 40 to 80 square meters planned area. The nursing area is 19 to 25 square meters planned area per planned bed. So the area that consumes most of the building space is surgical area, 130 to 160 square meters. The next one is NMR diagnosis, 100 to 150 square meters. The next one is central reception, 140 to 150 square meters. So the space requirement for the nursing area, for the intensive area, surgical area, rehabilitation area, physiotherapy area, X-ray area, radiotherapy, recovery area, NMR diagnosis, clinical physiology, clinical urology, central reception, delivery area, dialysis, specialized departments, for all this, the recommended area are given. The next slide, you can see the plan where the door should be there, where the stairs should be there, where the lift should be there, what should be the dimension of the bed lift. So the accessible corridors must be 1.5 meter wide. The patient corridors must be 2.25 meters wide. The normal door is 2.2 meters. But for vehicle entrance, it should be 2.5 meters. For transport entrance, it should be 2.8 meters. In a hospital, the width of the stairs must be 1.5 meters. The step height must be 170 millimeters. And thread depth must be 280 millimeters. So the next slide, we see in detail about the circulation area. So in this drawing, you can see that there is a service entrance for the administration, for the emergency service, and then emergency parking. So in case if it is an emergency service, they have access to the X-ray lab technician and then to surgery. So pre-surgery and post-surgery, they find their area. Near the consultation examination. Next, we can see about the external traffic control. If you look into this diagram, in the entire area at the rear end, you can see car parking for inpatients and administrative staff. And then there is an inpatient entrance. And then there is an administrative block, OPD entry. Again, at the end, there is radiology. And then emergency services. So there is one school of nursing within the campus. Staff nursing quarters is being made within the campus. The next, the OPD should have the facilities for screening, counseling, clinical examination, treatment, and referral. So the examination room should be close to the nurses station and the consultation room. So when you are making a case study of a hospital infrastructure, so these points will have to be very well noted. The consultation room is mostly used when lengthy conversation is involved between the doctor and the patient. Then there is a clinical department for outpatients, which includes clinics like general medicine and surgery, surgical, orthopedic, medical, pediatric, skin, ophthalmic, ENT, dental, chest, psychiatric, and cardiology clinic. These are all the different type of clinics. So based on the disease, they get their name. The minor surgery room, the ECG room, the minor operation room, they should all have a separate entrance. The support services include clinics which can use standard accommodation, general medicine, and surgery. Next, we will see about the inpatients. So inpatient means the procedure requires the patients to be admitted to the hospital so that he can be closely monitored during the procedure and afterwards for recovery. So in inpatient area, there should be an isolation unit. So an area of 14 square meters, where there should be a bed, locker, separate toilet facilities. So the wards for particular specialties, ENT, cardio, ortho, they should be located closer to the respective department. The ward shall comprise of 24 to 36 beds. Isolation rooms should be present for 15% of the patients. The aim is to minimize the work of the nursing staff and provide basic amenities to the patients within the unit. The orientation of the rooms should face southeast or south for adequate daylighting in the wards. The professionals will be able to give the width of the door, the distance between two beds. So now we will deal about emergency. So emergency renders services right from the elementary first aid to sophisticated management of surgical and medical emergencies and full-scale trauma care. So the emergency ward should be located on the ground floor with separate access to the patient's ambulance. And this should be separate from the outpatient entrance. So the emergency entrance should be well marked with proper lighting and signs and should be easily visible and accessible from the street. There must be a raised platform for the ambulance discharge, ramps provided for wheelchair and pedestrian access. Close to admission, medical records, cashier booth, laboratory services, and blood bank must be there. Proximity to elevators is also important in order to proceed to surgery without loss of time. Now we will see about radiology. Radiology includes the specialist area which use ionizing radiations for diagnostic and therapeutic purposes. These includes X-ray diagnosis, radiotherapy, and nuclear medicine. The radiology department should always be close to the ambulance entrance. All the equipments in the radiology department are very heavy, so they should be grounded properly on the floor. So usually radiology department will be on the ground floor. a connecting corridor, a dictating room, a switch room for the staff. They are all desirable. So usually in a radiology department, we have a sonograph, mammograph, jaw X-ray. So each of this instrument require 12 to 18 square meters. So the access route for the patient should be through 2 changing cubicles. Toilet should be installed in the X-ray room, especially for the patients with stomach or intestinal problems. We are now seeing a flow chart of the X-ray department. So next to the X-ray room, there will be a direct connection to the dark room, and then to the reading and interpretation room, and then to the doctor's QV room, file collection and storage. In the X-ray room, there should be a toilet, there should be an accessibility to changing room, and then to waiting room, and then to reception room. Next, we will see about physiotherapy. This department contains a wet area where an exercise pool is there, 4-cell bath, butterfly bath, inhalation rooms, massage bath, hand and foot bath. So in physiotherapy, slip resistant tiles should be used. So the physiotherapy department should have access to the main reception area, changing room, toilets for men and women, linen stores, waiting area, cleaners room, service room, and all of the additional rooms that are required. A gym is required. Because of the high internal temperature, construction should be in such that it is comfortable to the patient. So as far as possible, physiotherapy should be on the base floor where natural lighting can be admitted through roof light and light shafts. So next we will be seeing about the surgical unit. So this is a very lengthy flow. So we will be seeing about the surgical unit in next class. So thank you very much for your patient listening. In case if you have any doubts, you can ask me. I'm open, I'm available. If any one of you have any doubts, you can ask me. Okay. Thank you very much. Thank you for your participation. All the very best for your forthcoming examinations. See you tomorrow afternoon. Thank you. Thank you.
Thank you, sir.
Thank you very much.